More efficient, we deliver our medications faster, and most importantly, it's much, much safer.
We remove a lot of the risk of selecting the wrong medication, which is quite a significant risk in hospitals.
Welcome to the future of hospitals. Robots that sort and choose the right drugs after they've been prescribed to patients. A tubing system that shoots medication along the ceiling. This is behind the scenes at Perth Children's Hospital's robot-run pharmacy.
It's very, very futuristic. This is the most automated pharmacy in Australia at the moment.
Christopher Hops is the Chief Pharmacist at Princess Margaret Hospital. He says the new pharmacy at Perth Children's Hospital is as high-tech as they come.
The chutes that come from our whole pack robot go through to our dispensary, and they supply medications almost through the ceiling to the spirals in the outpatient pharmacy, and our robot will then go and pick the medication, put it in a box for delivery to the ward.
The engine room of the pharmacy is a labyrinth of machines that store and sort all of the medication needed for patients and outpatients. When it comes to medication in hospitals, one of the biggest concerns is that patients will be given the wrong dose or even the wrong medication altogether. Perth Children's Hospital says this robot-led system makes it much safer for patients.
Quite a significant increase in medication safety.
Jazz Hosking is in charge of the technical side of the operation. She says the system, which has been used extensively overseas, has been shown to significantly reduce dangerous mistakes.
We remove a lot of the risk of selecting the wrong medication, which is quite a significant risk in hospitals, particularly have big long drug names. They all sound the same, they all look the same. So by being taken to a particular drug with the flashing light, and there's also alerts if they access the wrong one accidentally.
Here's how it works. This robot stores thousands of packets of medications. It sorts them, keeps a check on inventory and expiry dates, and when orders come through, it dispenses them either through the overhead tubing system or into containers that are taken to the ward and locked in a secure cabinet.
It works quite quickly, so it's much more efficient than a technician or another pharmacy staff member having to pick the stock. It's also much safer because we barcode scan all the items in, so we know that the item we are getting is the item that we've asked for.
This machine is what they call the unit dose robot. It prepares single doses of medication for children and barcodes them to ensure the young patients get the exact dose of the right medication. The idea is that every dose is recorded and tracked to ensure nothing goes wrong.
We know that in Australia, 20% of healthcare-related errors are associated with medication, and something that we're striving to achieve here is to improve that and provide a safe environment for our patients.
The robotics won't be seen by patients, but the hospital says behind the scenes they'll be working 24 hours a day.
The most amazing pharmacy in Australia. It's the most automated pharmacy in Australia with its robotics, and it's a wonderful place to be.
it's hard to get everything done in the day, to find the time. Caring is the most important job. That's why we're all here. Caring can be easier. After years of working with robots in the acute care sector, Lamson have created the RoboCart to take out the legwork in aged care. The autonomous mobile robot transports meals, linen, clothing, medication, waste and supplies throughout the day. This means you can save hours of moving trolleys from one location to the next. RoboCarts can even call elevators and open doors automatically. Robotic automation alleviates manual handling of trolleys, creating cost-effective and standardized work processes, allowing for better service and better care. RoboCarts will reduce the risk of work-related injuries, working alongside staff. But most importantly, staff can spend more time doing what they do best. Uploading music and language also enables your RoboCart to become part of your community. Automatic charging. Safely and calmly navigates obstacles. The Lamson RoboCart is easily integrated with staff and residents. RoboCarts improve productivity, reduce downtime, and help care for your staff. Lamson RoboCarts can make a difference to your work surroundings, making work safe, fun, and innovative. Lamson, allowing staff to do what they do best every day. Care.
Mazda Motor Logistics Europe is the European distribution centre for Mazda parts. The goods arrive here from the head office in Japan and are distributed to our dealers across Europe. Our warehouse contains more than 75,000 different parts to provide the best possible service to our clients. At Mazda Motor Logistics, we use reusable cages and containers. These go to our dealers, so it's important to register them in our system. Previously, this was done manually, so human errors were inevitable. It was also time-consuming.
Data proposed a solution to Mazda Motor Logistics Europe to determine the flow of goods. We have chosen an RFID solution together with Mojix technology. RFID stands for Radio Frequency Identification. An electronic tag is read by an antenna. Because each RFID tag has a unique number, we know exactly what comes in and what goes out.
Wat dat er binnenkomt en wat dat er buiten gaat.
All the goods that are being shipped receive an RFID tag, which is printed on an RFID printer from Toshiba. Thanks to Mojix technology, we can use 32 antennas on 8 gates and only need one reader to activate all 32 antennas.
Thanks to RFID solutions, the registration is automated, so our people need to scan much less. We know at any moment where our returnables are, and the follow-up has become much easier. Together with Data and Mojix, we would like to continue to look for ways to expand the RFID solutions in order to further optimize the operation of our warehouse.
Today's hospitals balance complex care delivery processes with high logistics demands and strong cost pressures. Response time is crucial to delivering quality care to those who are at the center of attention, the patients.
Well, I think it's really important for the children that you take a lot of time for them because they don't know and don't understand the things going on here. You have to explain a lot, and it's not like the adult station where you can just leave the cup and the medicine and say, "Take those pills, please." The kids say, "What's that? I can't swallow pills." And then you have to practice that. You have to explain why they need to take the pills, and it's really important that you have the time for this, that you can take your time to explain everything to the kids.
For this very reason, the new Schwarzwald Bar Clinic in Villingen-Swiningen was designed from the start to reduce delivery and turnaround times. The clinic banked on the Swisslog pneumatic tube system.
Blood samples are taken more than once a day. In the past, we had to go from the children's clinic to the lab a couple of times a day. It was a long way that just took a lot of time. While someone was going back and forth, the ward simply lacked a nurse. And because this was often the case, everyone was really annoyed with this constant bustle. Right from the start, the idea was to solve this problem with a pneumatic tube system, because that's just the quickest and safest way to transport the samples from one place to another. That's a lot faster than a nurse or the pickup and delivery service bringing samples to lab or picking up medication from the pharmacy.
Swisslog provides automation solutions for hospitals, customized to meet their unique demands. Our pneumatic delivery systems provide the logistics backbone for high-speed delivery of medications, lab samples, and supplies.
To us, the pneumatic tube system is a quantum leap. The samples arrive at the lab faster than ever, and we can work with them more quickly. Currently, the sample's traveling time is at a maximum of 2 or 3 minutes. That's a huge advantage for us. These carriers are color-coded, and we can see up front, is there an emergency in any of them or not? To the senders, this is, of course, the best solution, because the data, the results, are available a lot quicker, and we cannot know each sender's number by heart. That's why the tube bombs have RFID chips. We can put them into the sending station, and they automatically go back to their home address. The tube bombs, well, that kind of became a common term for the carriers here.
Before we introduced the pneumatic tube system, there was no automated system. That means people transported the goods. Quite frequently, these were single samples for the lab or single biopsy specimens, which had to be transported across the whole clinic by nurses or other attendants. A nurse and any other attendant here is a highly qualified employee. This means they cost quite a bit of money. That's why you shouldn't use a highly qualified employee to do such simple transportation tasks. We can omit such costly tasks thanks to the pneumatic tube system and also gain economic advantages, that's for sure.
I am grateful that I don't have to walk all the way anymore. It just saves a lot of time. Time we can now use more reasonably, namely with the kids. The pneumatic delivery system was accepted right from the start. The staff gets along with it very well. It's really easy to use. The staff loves it. I wouldn't want to work in a hospital without a pneumatic tube system. As soon as you know how well and easily it works, you just don't want to miss it.
Contact us to find out how Swisslog Solutions can help you deliver a better patient experience.